listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. Today we're going to be talking about diabetes. Diabetes is one of the most common diseases in the world. It's estimated that over 50% of adult Americans have diabetes or are at risk of developing diabetes. So this represents millions of people who are affected by this disease. Now, there's always confusion regarding diabetes, and people hear different numbers or different topics or different relationships with it. So I thought on today's episode, I would actually go over the different types of diabetes, some of the ways that we diagnose it, and then some of the medications that are available to manage it. So that should help to clear up a lot of confusion. We'll start with type 1 diabetes. Type 1 diabetes typically affects younger people, usually children or teenagers. Basically, this occurs when the pancreas, which is an organ that lives in the middle of the chest, right next to your stomach, when the pancreas is not able to produce insulin. So insulin is a hormone. It's required by the body to force the blood sugar to be broken down. Normally, the insulin will break it down and uses the sugar as a fuel source, and it gets pushed into the muscles and the brain and other parts of the body. However, when you don't have insulin, as in a type 1 diabetic, the blood sugar just pools. It'll keep increasing in the blood where it's not beneficial. It never makes it into the muscles or the brain or the other organs that actually need the sugar, and the sugar is actually toxic. So it causes major side effects to the circulating blood. So people who have type 1 diabetes are usually very young. They could be 2 years old, 3 years old, 10 years old, and they're very, very sick. So these people oftentimes will be in the emergency room for some other problem. They'll be diagnosed with some type of infection, and then their blood sugar will be 400 or 500. And that's the first time that the parents have even found out that they actually have diabetes. Now, these individuals, because they don't make insulin, they require insulin injections. So these are people where you can't use any oral medication to start with. You have to jump ahead to insulin. There's injectable forms, there's insulin pumps, and we'll talk about that in just a little bit. But type 1 diabetes is insulin basically absent in the body, and it's required that you supplement that. Type 2 diabetes is actually the more common type, and this is becoming more and more prevalent each year. Type 2 diabetes means the body has insulin. In fact, it's making more insulin than it needs, but it's insulin resistant. So what that indicates is people who are obese, people who are overweight, people who have other health problems, they eat too much sugar, they have inadequate metabolism, the blood sugar increases, the body makes more insulin, but it can't keep up. And so type 2 diabetes is chronic. These are usually going to be in adults. These are people who otherwise work, they go to school, they have families, but their body is not able to metabolize the blood sugar, and it causes some major issues. These are people where the first-line medications are always going to be oral tablets or capsules, and then if those don't work, then they move on to other medication and finally insulin. Now, another category is called gestational diabetes. Gestational diabetes affects pregnant women. So during pregnancy, the developing baby each day is getting larger and larger, and babies love sugar. It's kind of weird to say that, but babies love sugar. And the reason is sugar is a fuel source. The problem is that if the sugar keeps increasing or the mother consumes too much glucose in the blood and it keeps rising, the baby will get bigger and bigger. So gestational diabetes causes very large infants. These are women whose babies are 8, 9, 10 pounds and still growing. Oftentimes those babies will have other issues and they may need to have a C-section. Okay, so gestational diabetes affects not just the mother, but also the developing baby. Now, there are medications that are safe during pregnancy to control diabetes, and so that is something that the doctor, the OBGYN, and possibly a specialist or an endocrinologist would need to be involved to help modify the diet, help to modify the blood sugar, and that'll keep the mother and the baby healthy. Now, the reason it's called gestational is that after the baby is born, technically, the blood sugar should go back to normal because the stimulus, which was the baby causing the blood sugar to rise, is now out of the body, and so the woman is no longer diabetic. They're still at risk of developing diabetes, and there are some estimates that say they're 8 times more likely later in life to get diabetes, but in the short term, meaning after delivery, in the 3-month checkup, 6-month checkup, 1-year checkup, those women should go back to a normal blood sugar as long as they don't have any other underlying issues. And then the last thing is called prediabetes or borderline diabetes. And this is something where your doctor will talk with you a lot about if you go in for some routine blood work, maybe you start a new job, maybe you have a life insurance policy, maybe your family just recommends you check your blood sugar, and it's a little bit high. So it's not high enough where you have to be in the hospital, but it's high enough that it's causing symptoms. In general, there are different ranges for what we consider to be normal, and different people have slightly different values. Officially, from the medical definition, a blood sugar of 126 or above is considered diabetes. So anything below that, so let's say between 100 and 126, you might be called pre-diabetic or borderline diabetic. And then people who are less than 99, by definition, that's a normal value. Now, there's different times of day, though, that your blood sugar can be fluctuating. So before you eat in the morning, before you have breakfast, that's your fasting level. So typically your fasting level is going to be the lowest because you haven't had anything to eat all night. You check it first thing in the morning, that's going to be your lowest number. And that number could be normal. Let's say it's 60 or 70. That's perfectly reasonable. After you have your breakfast, a donut, some coffee, things like that, it might rise. Let's say it goes up to 90 or 95. You're not diabetic. That's perfectly normal because your body made insulin to meet the demand of what you were eating. So your blood sugar is going to be back down to normal and you just carry on with your day. However, some people, even if they eat a little bit, like a cracker or a banana or an apple, it'll shoot up to 200. And now you have a problem because your body can't make enough insulin to break down that sugar. And so your blood sugar will stay high for the entire day. And that causes side effects. Okay. So again, prediabetes or borderline diabetes, that means it's getting up there. It's not in the range of diabetes. But if things don't change, if you don't change the way you eat, or the way you metabolize, or the way you exercise, or the way you watch your weight, then it's a high risk. In 6 months or a year or down the road, you will develop full-blown diabetes and then require medication. Okay? So those are the 4 types that we talked about. Type 1 diabetes, which is children, they don't make any insulin. They have to get insulin injections. Type 2 diabetes, which is the most common type of diabetes, that's the one that we see typically in adults and people with obesity. So these are people becoming more and more common. The gestational diabetes, which only occurs during pregnancy, and then everyone else, which is borderline diabetes or prediabetes. Those are numbers that have to be monitored, but not necessarily medication in the first steps. Okay? Now, the second thing that we'll talk about are some of the medications. So the first oral medication that we recommend for type 2 diabetes is metformin. Metformin has been around for decades. It's a very safe medication for most people. It works in 2 ways. One, it works on the liver, okay? And the other way is that it works on the rest of the body to sensitize the insulin. So I'll break that down for you. So the liver itself has 400 different functions. It's an amazing organ. So 400 different functions that we know of. It makes enzymes. It helps to digest our food. It does other activities that we can't even adequately explain. However, the liver also makes sugar. And that's a process called gluconeogenesis. So gluconeogenesis occurs usually at night. So I mentioned, when you have your dinner, you go to sleep, you don't eat anything while you're asleep until first thing in the morning when you wake up and you have breakfast. So during those 8 or 9 hours, the body actually raises blood sugar naturally through gluconeogenesis. So the liver is producing its own sugar. And these are people who, for example, they cut out all their carbs, they don't eat sugar, but their blood sugar is still high. So where is it coming from? Well, that's this source, which is the liver. Metformin turns that switch off. So when you take metformin twice a day, it's a twice-a-day medication typically. There is a once-a-day medication available similar to it. It turns the switch off at the liver, and it tells the liver, don't make any more sugar. We don't need it. We have enough. And that lowers the blood sugar quite a bit. The other way that metformin works is as an insulin sensitizer. So what that means is that the insulin that's already in your body becomes more effective. It's almost like adding a little super punch of the strength or the potency without any major side effects. So the metformin works in both ways. It allows your own body's insulin to work better, and that'll lower your blood sugar. And it also turns off the switch at the liver so you don't make any more blood sugar. And for many, many people, this is all they need. It's just one medication to control it. If the metformin doesn't work, if the lifestyle changes, losing weight, exercise, all those things are not working, then you may need to add more medication. And there's several types. There's medicines that work on the pancreas. There's medicines like glyburide and glimepiride. There's newer agents. There's combination medications. So I'll leave that to you and your doctor and your pharmacist to decide because each of them have some benefits and some risks. So it's really dependent on the person, their age, and basically how they feel comfortable with that. If none of the oral medications are working, there's injectable medications that are newer agents, which are very, very strong. They're all brand name, so they're a little bit expensive. So again, you'll have to talk with your doctor or your pharmacist to see if those are appropriate for you. The benefit with some of the newer injectable medications is that they help you lose weight. And so a lot of people are using those now almost as a weight loss regimen. Even though it helps with the blood sugar, it's tremendous at losing weight as well. So that's something you can discuss with your doctor on the next visit. And then the last type of diabetes medication is insulin. Insulin has been around for decades, and there's various forms of insulin. There are regular insulins, which last for about 12 to 20 hours. There's long-acting insulin like Lantus, which is a 24-hour medicine. And then there's short-acting insulin or combination insulin, which are taken at meals, for example, breakfast, lunch, dinner, or whenever you need to give a little burst. So there's different types of insulin. Generally, this is managed by either your family doctor or your endocrinologist, and they'll help to come up with a formula, a little chart. So you check your blood sugar a couple times a day, you mark it down in a little book, and then you can calculate how much insulin to give yourself. Then there's the insulin pump, and the new ones are phenomenal because the new ones are connected to Wi-Fi, they have digital instructions, and they can actually check your blood sugar and give you insulin at the same time. So the new insulin pumps are doing a great job, especially for our younger patients or for people who have a hard time with taking medication. Maybe they live alone, maybe they have other risk factors. And I think in the future, you'll see more and more people using insulin pumps because they're just better than medication. And they help to prevent some of the complications and the side effects. So you'll see many people in your classes, at school, at your job, and other places on vacation who have insulin pumps and are otherwise perfectly functional individuals. And you'll be surprised at how well that these new technology advancements can benefit them tremendously. Okay, so we talked about the different types of insulin, some of the treatments. And then why do we treat why do we treat diabetes? What is the main issue with diabetes? So as we mentioned earlier, blood sugar or glucose is a poison. So the body uses it as fuel, and if it burns it up, that's great. But excessive amounts of glucose are toxic. It's actually a poison that damages different organs in the body in different ways. So for example, the heart doesn't like high amounts of blood sugar. It increases the risk of heart attack, strokes, and blood clots. Very, very serious problem. People die if their blood sugar is not well controlled. It also causes something called neuropathy, which is nerve damage. So nerve damage affects the feet especially and the legs, causes numbness and tingling, and it causes people to stumble and fall. It causes infections in the feet, which are very severe, very difficult to treat, and many diabetics who are not well controlled will have amputations. They're going to lose one or both of their legs due to diabetes because the blood sugar is so high. It just eats away at the nerves. People don't realize they hurt themselves, they stepped on a nail, they have an infection on the bottom of their heel, and it's been there for months. By the time they come to the hospital, the bone is already eaten away, and the only treatment is amputation. So you can imagine that would be very devastating. Those people have to be in a wheelchair or get a prosthetic leg. They're not able to do the things they enjoy anymore. The diabetes also affects the kidney because the kidney is trying to push out all of this extra blood sugar into the urine. So we actually measure the urine sample glucose values, and we can oftentimes tell if people have problems, including ketones. Ketones are byproducts from very high blood sugar. And if people have very high ketones, very high blood sugar, they can actually go into a diabetic coma called DKA. And that's a very serious problem. So the kidneys can actually develop severe issues causing kidney failure if the blood sugar is not monitored. And then people can go blind. So that's called retinopathy. The high blood sugar causes damage to the blood vessels in the eye, which is the retina, and that leads to glaucoma, cataracts, and blindness. So think about it. You have someone who's not taking care of their blood sugar. They're eating all the wrong foods. They're not taking their medication. They're going to go blind. They're going to develop heart attacks. They're going to develop strokes. They're going to have nerve damage in their feet, and they're just not going to be very functional. And that's why we are really, really encouraging people, check your blood sugar. Just go to your health fair, go to your family doctor. They'll check it for you, no problem. It takes 5 minutes to get your blood sugar checked. They'll write it down for you, offer you some suggestions, and then you can see what you can change in your own life to manage it. And then down the road, hopefully you can avoid medication. But if not, and I always tell my patients the same thing, if the lifestyle modifications are not working, you have to really get some help. So the first agent is going to be metformin. For most people, that's a great medication. First line option, very few side effects. If that doesn't work, they'll go to a second line or a third line option. And then if nothing works, they're going to go on insulin. But it could really make a big difference in the quality of life. And hopefully that'll allow you to stay healthy and active for many, many years. So I hope you learned a little bit about diabetes and the different types, along with some of the treatments and the lab values. If you have any questions, feel free to send us messages on our Instagram or Twitter page. I'll do my best to respond with some general information, but definitely follow up with your doctor about any concerns or questions. I'll have a blog updated with this website information so that way you can read it, you can explain it to your family and friends, and hopefully keep yourself healthy. So thank you again so much for joining me on this week's episode, and I look forward to having you again back on next week.